Now we are ready to talk about the fourth step in the nonviolent restraint process. In this section, we will cover how to complete the frequent 2-hour nonviolent restraint monitoring documentation. All documentation should be completed via the task. Once again, if you're doing this from ED, your task is via the ED tracking board on the clipboard icon, versus inpatient task will be located on Care Compass. The task is labeled Restraint Monitoring Nonviolent Behavior. In OneChart, expand the task list on Care Compass. Click on the task Restraint Monitoring Nonviolent Behavior and click Document. The task should be documented at least a minimum of every 2 hours. This opens a grouping of documentation. You need to ensure the time in the column is accurate and reflects the actual time the assessment was completed. To change the time of the column and also have your task be removed when you sign the documentation on Care Compass, use the following steps to change the time of the task documentation. Before any charting, first we're going to select the blue barrel icon. We're going to enter the correct date and time, and we'll click the check mark next to the task that we want to change and click OK. The nurse should document every field within the task except the fields labeled violent. Now let's take a moment to review the specific fields and an explanation of what should be documented in each field. Under the first section for restraint monitoring, the first field is nonviolent behavior requiring restraint, only option available as a behavior interfering with medical care devices. The next field is violent behavior, so we will skip that field. The next field is restraint episode activity type. Select continue episode. This next field, restraint behavior description. Select other and utilize the free text box to further describe the patient's behavior. Within this field, there's another response, resting quietly with eyes closed. This should be used sparingly and only when it is in the better interest of the patient to allow them to rest and not wake them to provide them nutrition or hydration. The next field is restraint range of motion. Select the response that's most appropriate. Next, restraint nutrition hydration. Next, restraint elimination. Next, restraint circulation sensation. The next field, restraint DC readiness attempts. This field should be utilized to capture what clinicians are doing continuously to attempt to remove the patient from restraints. In our example for today, we will select that we have provided comfort measures and reality orientation. The next field, nonviolent release criteria for restraints. This field should be looked at as what the criteria is that the patient must meet prior to being released from restraints. We will select the most appropriate response. This section, violent release criteria, will be skipped as there is a violent in the header. Now under the next section, restraint evaluation, ensure there is a label for each limb that is restrained. Under each limb that is restrained, document in the two fields. The first, restraint activity type. Select continue restraint same episode. However, for certain situations, like if you changed out a restraint, if it was soiled, you would select apply new restraint same episode. The next field, evaluation of status in restraints. In most all situations, the clinician will select the top 3 options. Restraint applied appropriately, no evidence of adverse effect related to restraint, and no evidence of injury related to restraint. This same information needs to be documented on each limb that is restrained. Now we will click the green check mark to sign the documentation. When we navigate back to the task list, either Care Compass for inpatients or the tracking board for ED, after clicking refresh, you will see the task is removed. The above steps would be repeated every 2 hours. The next step we will cover with the nonviolent restraint process is regarding ensuring there's a daily renewal order. The daily renewal order is needed every calendar day according to the Joint Commission, CMS, and Via Christi policy. The requirement is the ordering physician evaluates the patient daily to ensure the need to continue restraint use. The ordering physician receives a message in the message center as notification to take an action and place a renewal order. Nursing will review the restraint power plan and ensure a daily renewal order is on the chart for each calendar day. If there isn't a renewal order, nursing will need to call the physician and obtain an order to continue restraints. We will cover how to review the patient's chart to ensure a renewal order is on the chart, and if not, how to place a daily renewal order. Within the patient chart from the left table of contents, select Orders. Within the Orders view, locate the power plan, Restraint for Nonviolent Behavior. This power plan should have one main power plan or tree trunk for the initiate phase with many different phases or branches for each renewal calendar day. Click on the main power plan and review to ensure a renewal order for each calendar day the patient has been in restraints has been placed. In our example, you can see the initiate monitor order was placed on 10/12 with a daily renewal order on 10/13 and again on 10/14. In our example, the physician has not entered a renewal order for this calendar day. The nurse has called and received a phone order for the restraint renewal. Within the Orders View panel, right-click on the last restraint continue phase that is already initiated for the previous calendar day and select Copy. Click Initiate, filling in the appropriate physician's name you received, orders for signature, and sign. To quickly review, for each episode of restraints, you should have one main power plan with many different phases for each calendar day the patient continues to be in restraints. After placing the daily renewal order, the clinician will see a separate task on Care Compass. The task is labeled Restraint Continue Nonviolent Behavior. This task is attached to documentation that is meant to justify the reason for continue restraint use. In Care Compass, on your task list, you're going to see a task appear, Restraint Continue Nonviolent Behavior. When you click on the task and click Document, once again, document in every field except those labeled violent. This is also a good opportunity to document the learning assessment, who was present for the session, and what topics you re-educated the patient family caregiver on regarding restraints. Click the green check mark to sign your documentation.